Introducing Zeposia, the groundbreaking treatment that is revolutionizing the way we approach multiple sclerosis, MS. In this video, we will delve into the power of Zeposia and how it is changing the lives of MS patients worldwide. MS is a chronic condition that affects the central nervous system, causing a range of debilitating symptoms. However, with the emergence of Zeposia, there is newfound hope for patients looking to regain control over their lives. With its innovative mechanism of action, Zeposia works by targeting specific receptors in the body, reducing the inflammatory response that leads to MS progression. This groundbreaking treatment not only slows the advancement of the disease but also prevents relapses, ultimately improving the quality of life for those living with MS. Understanding the mechanism of Zeposia in treating MS. Zeposia, also known as ozanimod, is an oral medication that belongs to a class of drugs called sphingosine 1-phosphate receptor modulators. These drugs work by binding to specific receptors in the body's immune cells, which helps in reducing the infiltration of these cells into the central nervous system. When MS occurs, the immune system mistakenly attacks the protective covering of nerve fibers, known as myelin. This leads to inflammation, the formation of scar tissue, and disruption in the transmission of nerve signals. Zeposia works by modulating the immune response and preventing the immune cells from attacking the myelin, thereby slowing down the progression of the disease. The unique mechanism of action of Zeposia sets it apart from other MS treatments. Unlike some traditional therapies that suppress the immune system as a whole, Zeposia targets specific receptors, providing a more targeted approach to managing MS. Clinical trials and research findings on Zeposia's efficacy. Extensive research and clinical trials have been conducted to evaluate the efficacy and safety of Zeposia in treating MS. One such study, known as the Sunbeam trial, involved over 1,300 patients with relapsing forms of MS. The results showed that Zeposia significantly reduced the annualized relapse rate compared to a placebo. Another study, called the Radiance trial, focused on patients with relapsing remitting MS. The findings demonstrated that Zeposia reduced the number of new or enlarging lesions in the brain and spinal cord, as measured by magnetic resonance imaging, MRI. These positive outcomes highlight the potential of Zeposia in preventing disease progression and improving patient outcomes. The long-term safety and efficacy of Zeposia were further evaluated in an extension study called ENDURE. The results revealed that treatment with Zeposia continued to be effective in reducing relapses and disease activity over a period of up to 5 years. Additionally, Zeposia demonstrated a favorable safety profile, with most adverse events being mild to moderate in severity. Comparing Zeposia with other MS treatments. When it comes to treating MS, there are various options available, each with its own benefits and considerations. Zeposia stands out among these treatments due to its oral administration and targeted mechanism of action. Some traditional MS treatments, such as injectable medications, require frequent injections and can be associated with injection site reactions. Zeposia, on the other hand, is taken orally once daily, providing a convenient and less invasive option for patients. Compared to other oral medications for MS, Zeposia has demonstrated comparable or superior efficacy in clinical trials. For example, in head-to-head trials against another oral medication, Zeposia showed a significantly lower annualized relapse rate and a higher proportion of patients free from relapses. It's important to note that the choice of treatment should be individualized based on the patient's specific needs, preferences, and overall health. Consulting with a healthcare professional is crucial in determining the most appropriate treatment approach for each MS patient. Potential side effects and safety considerations of Zeposia. Like any medication, Zeposia may cause side effects, although not everyone will experience them. Common side effects include headache, elevated liver enzymes, respiratory infections, and high blood pressure. These side effects are generally mild to moderate in nature and can often be managed with proper medical guidance. One unique consideration with Zeposia is the potential for a decrease in heart rate when starting or increasing the dose. To mitigate this risk, patients are typically monitored for 6 hours after the first dose and receive a gradual dose escalation. This safety measure ensures that the treatment is well tolerated and minimizes the risk of adverse events. It's important for patients to discuss any existing medical conditions, medications, or concerns with their healthcare provider before starting Zeposia. This will help identify any potential contraindications or interactions that may affect the suitability or safety of the treatment. Dosage and administration guidelines for Zeposia. Zeposia is available in the form of capsules and is taken orally once daily. The recommended starting dose is 0.23 mg, which is gradually increased to the maintenance dose of 0.92 milligrams over a period of 7 days. This dose escalation strategy helps minimize potential cardiovascular effects, ensuring a smooth transition onto the full dose. It's important for patients to strictly follow the prescribed dosage and administration guidelines provided by their healthcare provider. Skipping doses or altering the treatment regimen without medical guidance may impact the effectiveness of Zeposia in managing MS. Patient experiences and testimonials with Zeposia. The introduction of Zeposia has brought about positive changes in the lives of many MS patients. Numerous testimonials and personal stories highlight the transformative impact of this treatment on symptom management, relapse prevention, and overall quality of life. Patients have reported a reduction in the frequency and severity of relapses, improved mobility, and increased energy levels while on Zeposia. Many have expressed gratitude for the convenience of oral administration and the minimal disruption to their daily routines. It's important to remember that individual experiences may vary, and not all patients will respond to Zeposia in the same way. Consulting with a healthcare provider is essential in determining the most suitable treatment approach based on the patient's unique circumstances. Tips for managing MS symptoms while on Zeposia. While Zeposia is an effective treatment for MS, it's important to complement it with a holistic approach to symptom management. Adopting a healthy lifestyle, including regular exercise, a balanced diet, and stress reduction techniques, can help optimize the benefits of Zeposia and improve overall well-being. Engaging in physical activity, such as walking, swimming, or yoga, can help maintain muscle strength and flexibility, reduce fatigue, and improve mood. A well-balanced diet rich in fruits, vegetables, whole grains, and lean proteins can provide essential nutrients to support overall health. Additionally, managing stress through techniques like mindfulness, meditation, or relaxation exercises can help alleviate symptoms and improve mental well-being. It's also important to establish a strong support network, whether through family, friends, or MS support groups, to provide emotional support and navigate the challenges of living with MS. Consultation and prescription process for Zeposia. To access Zeposia, patients are required to consult with a healthcare provider who specializes in MS treatment. The healthcare provider will evaluate the patient's medical history, conduct necessary tests, and discuss the potential benefits and risks of Zeposia. Once deemed appropriate, the healthcare provider will provide a prescription for Zeposia, which can be filled at a local pharmacy. It's important for patients to communicate any concerns or questions they may have during this process to ensure a comprehensive understanding of the treatment. Conclusion and future prospects of Zeposia in MS treatment. Zeposia represents a significant advancement in the treatment of multiple sclerosis, offering new hope to patients worldwide. With its innovative mechanism of action, proven efficacy, and convenient oral administration, Zeposia is changing the treatment landscape for MS. Through extensive research and clinical trials, Zeposia has demonstrated its ability to slow down disease progression, reduce relapses, and improve overall symptom management. The positive patient experiences and testimonials further validate the transformative impact of this treatment on the lives of MS patients. As research continues, there are exciting prospects for the future of Zeposia in MS treatment. Ongoing studies are exploring its potential use in other forms of MS and its long-term effects on disease progression. These advancements hold the promise of further improving patient outcomes and expanding treatment options for individuals living with MS. In conclusion, Zeposia has unlocked a new era of hope for those battling multiple sclerosis. With its powerful mechanism of action, proven efficacy, and patient-centered approach, Zeposia is revolutionizing the way we approach the treatment of MS. By understanding the science behind Zeposia, considering patient experiences, and collaborating with healthcare professionals, we can unlock the full potential of this revolutionary treatment and empower MS patients to live their lives to the fullest. Thanks for watching.